Assalamualaikum. Today our group would like to present to you about safe food handling during COVID-19. So, for start, what is the background of this project? So the background of this project is basically the world right now is facing an exceptional threat from the COVID-19 pandemic caused by COVID-19 virus. With more than 150,000 confirmed cases globally, the World Health Organization (WHO) declared that COVID-19 as a pandemic. This is written in Nicholas et al. 2020 journal. There is no medication that treats people with COVID-19 illness. So, the best way to protect ourselves is to prevent infection in our own ways. This is from FAM 2020. In previous research, evaluated that the survival of COVID-19 virus on different surfaces reported that the virus can remain viable for up to 72 hours on plastic and stainless steel, up to 4 hours on copper, and up to 24 hours on carpet. This is from previous journals of Patients et al. 2020. Besides that, young adults have high confidence in their ability to handle food safely. However, not many individuals lack appropriate knowledge and engage in unsafe behaviors. Safe food handling and preparation behaviors of society have generally been measured in this situation, in which they were handling food for themselves. This is in report by Courtney 2016. Therefore, some steps that can be taken in particular areas of public health, that is through hygienic action. In particular areas of public health, that is through hygienic action that reduce the risk for foodborne illness, which can also reduce the risk of this virus. Besides that, it is vital for the society to reinforce hygiene and personal measures and provide good practice on food hygiene principles to eliminate or reduce the risk of food surfaces and food packaging materials from becoming contaminated with the virus. Therefore, this research aims to investigate the level of awareness of society on implementing safe food handling during COVID-19. So, besides that, we would like to discuss on what is the purpose of this study. So, we have 3 objectives. The first one is to study the level of awareness of society on implementing safe food handling during COVID-19. The second one is to raise concern to society about COVID-19 infection from food products. The third and the last one is to recommend ways to promote safe food handling during COVID-19 to the society. So, our scope of this project is to collect sample from 100 respondents that were randomly selected based on different age. That's all from me. Next, I would like to pass to Nur Haryati for the next part.
Hi, I am Nur Haryati and I will be presenting both literature review and research methodology part. First, let me present the literature review. In this part, I divided into 4 sections. First section, I will discuss more on potential transmission COVID-19 throughout the food, where I refer based on these 2 research papers. First is based on European Commission, Directorate General for Health and Food Safety. They state that there is no evidence that we can get the coronavirus disease through food or food packaging. But as mentioned in the WHO article, World Health Organization article, even though there is no evidence, there is a high possibility that it can be transferred throughout the food if we did not apply hygienic rules when dealing with the food. And someone might get infected after touching the contaminated objects and surfaces. And this is why we need to be cautious and practice maximum hygienic rules, especially towards the food that we eat. Second section, I will be focused more on food delivery guidelines amidst the COVID-19 pandemic. In order to reduce the risk of food delivery workers from the virus, they must screening their health frequently, wear masks, and use hand sanitizer with alcohol content at least 60% above, as mentioned by the San Francisco Department of Public Health Research paper. Why we need 60% alcohol? Because this is to make sure that it will work or eliminate the coronavirus. The next section is retail store challenges amid the COVID-19 pandemic. So in this session, I refer to the World Health Organization research paper, where the retail store faces the greatest challenges amidst pandemic in maintaining the highest standards of hygiene, protecting staff from the risk of infection, maintaining physical distancing, and ensuring that adequate supplies of food. So workers in retail premise must follow the standard given as they are highly exposed to this virus. So they need to make sure to regulate the number of customers, and they must identify the high touch points to ensure these are clean and disinfect regularly to minimize the transmitting risk of the virus. So for the last section of literature review, I will focusing on foodborne illness awareness. So this awareness is mentioned in the research paper by Joshua Feng, an assistant professor from Department of Food Science from Purdue University. So she mentioned that this illness awareness is important for those who are at high risk, especially towards the people with weak immune system. So those who are weak immune system include pregnant women, elders aged above 55, and children aged under 5. So we need to prevent them from eating raw meat, raw sprouts, raw milk, and mushrooms, as these foods can be the source for foodborne pathogens that make people sick. So extra care and attention should be placed on proper cooking and chilling, as this kind of person are high risk if they contaminate with the virus. So next, I will present about our research methodology. So this research study was carried out during the COVID-19 pandemic, where most UNITL students is living in their own homes because of the lockdown announcement by the government since April. So this survey is blast through the media social platform for 1 month. There is 102 total respondents from various social backgrounds were collected, and it might not limit to only Malaysian respondents, as there are a few respondents from foreigners as well. Maybe this is due to the unlimited access on media social platform, where the foreigner respondents able to reach the survey, to reach our survey. So we distribute one set of questionnaires which consists of 4 sections with a total of 7 questions. So for the next part, I will pass to the Muhammad Ikhwan to present the result based on our questionnaire. Thank you.
Thank you, Harati. I will present about data collection and analysis. This chapter will present the finding of this study based on the objective identified early in the report. Data from the questionnaire were collected and analyzed, and the significant results are further discussed and explained in detail in this chapter. First, demographic profile of the respondent. There are 102 valid questionnaires were obtained. About 63.7% of the respondents were 18 to 30 years old, and another 15.5% were under 18 or over 50 years old. 11.8% of the respondents were 31 to 40 years old, while another 8.8% were 41 to 50 years old. Next is respondent knowledge about how COVID-19 can spread by touching. 78.4% show that they know that by contacting a contaminated surface can spread the virus, and the rest of 21.6% responded that they did not know that by touching a contaminated surface can expose the individual to the virus. Next question is respondent awareness about foodborne illness. As you can see from the pie chart, 67.6% of the respondents respond yes. Some respondents who are 32.4% claim that they still not knowledgeable about foodborne illness. The importance of eating clean food is to prevent foodborne illness because awareness of this illness can be beneficial in reducing the risk of the virus. Okay, for the next question is about responder safety routine before and after grocery shopping. There are 2 questions that has been given. For the first question, you can see the result that most of the respondents often sanitize their hand before grocery shopping, and some respondents never sanitize their hand. The result for the second question also show that the respondent generally clean their reusable shopping bag before or after grocery shopping. However, some of them claim that they never clean their reusable shopping bag before or after grocery. From that both questions, we can conclude that there are many respondents still aware of the safety precaution before and after grocery shopping. For the fifth question is responder concern about age limit and number of persons to represent one household. Based on the result, 90.2% of the respondents agree that children should be banned from shopping grocery and limit only 1 or 2 persons to represent one household. On the other hand, some respondents who are 9.8% claim that they disagree with this statement that has been asked. For the second last question is about how often this hygienic rule apply in your kitchen. From the bar graph, we can illustrate that over 60% respondent respond that they often store food properly to prevent contact between raw and cooked food, and for over 50% of the respondents respond that they often discard outer packaging before storage and clean the fridge and kitchen surface. We also can illustrate that most of the respondents also respond that they will wash a knife plate, or any kitchen appliance after using them for different food. Based on the result, we can conclude from the bar graph, most of the respondents always have this hygienic rule applied in their kitchen. Last question is open-ended question. For this question, we will ask an opinion from the respondent on how to improve the level of awareness among the public to implement safe food handling during COVID-19. Based on the open-ended question, most of the respondents felt that to improve awareness among the public is to spread the message on how to implement safe food handling through media social, television, advertising, or campaign. The second most opinion that has been given is to implement the enforcement of secure food handling by enact with the law by the government. Last, the third most opinion that has been given is that parents should teach their children about the implementation of safe home cooking. That's all from me. Thank you. I will pass to Ilham.
Thank you, Ikwan. Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Aidi Ilham Yunus, and now I want to present about the conclusion of this research. First, the findings reveal that safe food handling is significant to prevent COVID-19. The World Health Organization stated that this virus cannot transmit through the food which is cooked safely. However, this virus can transmit on the surface of the food product for a few days. From the survey also, most of the respondents aware of COVID-19 that able to spread through contact between individuals or objects. However, they do not practicing the hygiene procedure, which is wash their hand with soap after grocery shopping or when they handling the food. Next, the respondents acknowledge that safe food handling could prevent the virus from spreading. And the last one is the result of the study cannot be used as examples to illustrate the practice of food hygiene in Malaysia. However, the consistency of the answer of the survey is very important to give a clear picture about the level of awareness on safe food handling during COVID-19 in the community. For the recommendation, the public should practice proper hygiene protocols when handling or preparing food. For example, they need to dry the food or wash the food product frequently when they want to cook. Next, the society needs to wash hands frequently and avoid touching their face after contact high-touch surfaces. This hygiene practicing is very important because it will kill or remove the COVID-19 virus from their hand. So, the example of high-touch surfaces, especially in house, the knob of the door and also the surface of the pipe. Next, the company that related food industry need to ensure their workers have to practice safe food handling. The organization structure need to play their part to make sure their worker wash their hand frequently before and after they work. And last but not least, educate the public about the importance of implementing safe food handling by using advertisements at various media platforms. Recently, the social media is a wide media platform that easily spread the advertisement. So, the advertisement is very important to give information for the society to practicing safe food handling, especially during COVID-19. I think that's all from me. Thank you.